Namaste, a very warm greetings to all the women journalists around the globe. This is iWatt Presents webinar on mental well-being for women journalists amidst the pandemic. I would like to welcome you all to today's webinar. And I am Manita Pokhrel, the iWatt board member, iWatt Nepal chapter board member here in Nepal. First of all, I would like to thank iWatt Nepal chapter for trusting the issue that is mental well-being of women journalists, as women journalists all around the globe has been busy working, even it's pandemic outside, and their mental health, their mental wellness is very important actually for all the global citizens. Thank you for trusting the issue, and we would like to thank iWatt International for believing collectively Nepalese journalists, Nepalese women journalists, and we are here today finally organizing this virtual webinar on mental well-being. So uh, I would also like to thank all the participants here who have made their time out of their busy schedule. And today we would like to proceed forward without further delay. Please allow me to witness the pleasure of inviting the president of iWatt International, Ms. Violet Ganda, for her welcome remarks. The floor is
Thank
yours.
thank you very much, Melissa. Hello, everyone. I am Violet Gonda, the president of the International Association of Women in Radio and TV, which, as many of you know, is a global organization which was formed by professional women working in and with all forms of media and communication. And we have more than 400 members in at least 15 countries and 14 national chapters that are registered in Africa, in Asia, America, and Europe. And iWatt has actually grown into a worldwide network with a mission to strengthen initiatives that ensure the justified women's role in media and guaranteeing their views and values, that they can become an integral part of programming, and also improving the portrayal of women working in the media. So, hope you are all well during these trying times. And I'm very happy to be with you today for this special online event that will deal and tackle a critical issue as we try to balance our professional and personal lives in the middle of a global and destructive pandemic. As you know, the COVID-19 pandemic has strongly impacted us, the journalism industry, and affected journalists' work and also our well-being. So on behalf of iWatt International, I would like to thank our iWatt Nepal chapter for taking the initiative and organizing this very important virtual webinar on mental well-being for women journalists amidst the pandemic. And I'd also like to thank Dr. Rita Ametia, who is a consultant psychiatrist at the Nepal Medicity Hospital, to give us her expert views on these issues that concern us as practitioners, and also she'll be helping us with perhaps coping mechanisms as we try to do our work and also stay alive, with this deadly virus around us. How do we deal with the pressures? What sort of help can we give each other? I, for one, am personally interested to hear the answers to some of these questions, as only yesterday we laid to rest one of my dearest friends, a decorated journalist who died in Zimbabwe a few days ago because of this COVID. We are all losing family and friends, family members, friends, relatives on a regular basis. And this takes its toll on the mind and affects our well being. How are we supposed to cope and do our work during these trying times when we are surrounded by death and sickness? And the long duration of the pandemic may have resulted in a COVID-19 information fatigue that could also pose a challenge for journalists. So it has changed our lives, the way we think and live. And as time goes on, it's clear we will have to find ways of living with it, as the world cannot be in a lockdown mode forever. We look forward to this discussion. And again, I would like to thank Dr. Amitia for taking time out to help us think about how we can protect ourselves and others during these times. And thank you all for participating in this important virtual seminar.
Thank you, President Violet Ganda. It was very inspirational hearing you. Now, moving forward towards the prime segment of today's webinar, I would like to present a brief profile of her first of all. She is the key speaker for today, and as her name has already been familiar to us, Dr. Richa Amatia. She is an aspiring consultant psychiatrist at Department of Psychiatry of Nepal Medicity Hospital and also Sri Birendra Army Hospital. And she completed her MBBS from University of Science and Technology, Chittagong, Bangladesh. She pursued her career as a psychiatrist and completed her MD in psychiatry from Manipal Teaching Hospital, which is in Pokhara, Nepal. She worked as a lecturer in Kathmandu University Hospital, which is located at Dhulikhel of Nepal, and she also has played a very key role working as a correctional psychiatrist for the prison inmates at Dhulikhel Prison, Nepal. As we have mentioned, the session will include doctor's presentation followed by question and answer. Thus, when you have any questions, please write it down on the chat box. We can entertain it later on, or you can raise your hand after the presentation is over. For now, I would like to request our key speaker to begin her presentation.
Hello, everyone. It's very nice to be here. I'm very much honored to be speaking among very aspiring, very wonderful female journalists here. So basically, today we are going to be talking about mental health well-being among women journalists, to be more specific, during this pandemic. So I'll be sharing the screen of my presentation. Is it visible?
Yes, visible.
Yes. All right. Okay. So, yes. So today we'll be discussing about mental well-being amidst this pandemic. So yes, COVID-19 pandemic, it has hit us hard. It has affected us in many different ways. And yes, we are coping with it, but how well are we coping with it? So that's the main question. And with today's presentation, I hope to, be able to impart certain ideas so as to be able to cope with the situation much more efficiently and also to manage our stress during this time of crisis. So going ahead with the presentation. So first of all, I would like to discuss what mental health is. So according to WHO, mental health, it's a state of well-being in which an individual realizes his or her own potential, his or her own abilities, can cope with the normal stresses of life and can work productively and is able to make a contribution to the society, to the community. So basically what it means is, if we are able to realize our own potential, and if we are able to control our own emotions, and if we are able to carry out our day-to-day activities, we are considered to be mentally healthy. And what I would like to remind us all is that mental health is as equally as important as physical health, if not more. So it's mental health is not just an absence of mental health disorders, it's an integral part of health. It's an integral part of health. So basically, in terms of etiological background of mental health, we can divide it into biological, psychological, and sociological aspects. So in terms of biological, since we are women here, basically focused on women journalists here, so what I would like to focus on the biological aspect is the role of the hormones. Yes, genetic aspects also play an important role in the biological sector. It's considered that if there are first-degree relatives in your family, in our family, who are suffering from mental health disorders, there's higher chance of us suffering from any other sorts of mental health disorders than the general population. So in terms of genetics also, there's a role. And in terms of hormonal levels, hormonal changes, since we are women, it's a concerning factor as well. And in terms of social and psychological, the environmental factor, the environmental stress, it plays a big role. So first of all, discussing about our vulnerability. Since we are women, why are we vulnerable? So we are biologically different than men. And the reason as to why we are biologically different is because of the hormones that plays within us. So you can see here in this graph that in terms of testosterone, which is indicated by the dark dotted line, it's seen that the level of estrogen, it peaks during the teens and then it steadies over the life cycle of a male. However, the blue line and the green line, which is shown here, it indicates the level of estrogen and progesterone. So these hormones, it peaks after our teen years, and there's an erratic ups and downs throughout the female life cycle until menopause. So this hormonal changes, it plays a great role. So what happens is, in terms of females, if you I've taken the example of depression here, the incidence of depression in case of female life cycle, which can be which can be which can be like in terms of the hormonal level changes, it's seen that the level of depression, it changes, it peaks after you reach your teen levels. It's at the same time, at the same time your hormonal level peaks, the same time your chances of getting depression also peaks. Whereas in case of males, although their testosterone level rises after teens and then it stabilizes, the same thing happens with their chance, with them having a chance of being more vulnerable to depression. So it's quite steady. For males, it rises at the time of teens and then it steadies. It's like steady throughout their life cycle. Whereas in case of females, due to these hormonal fluctuations, we are more vulnerable. And with this graph also, it's quite clear that in terms of male is to female ratio, females are twice as likely than males to suffer from depression. So it's not only about depression here, it's quite similar over other mental health disorders as well. So females are much more vulnerable to them. Okay. So now coming to the environmental factors, stress. Okay, so stress. What is stress? So any type of physical or chemical or emotional factors that causes bodily or mental tension and may be a factor in disease causation. So that's called as stress. And so stress is also a way that our body responds to any type of demand or any type of threat. So any type of change that occurs in our environment, it can lead to stress. Okay, so when we go through stress, there are a range of emotions that we can face. Like we can be sad, we can be angry, we can be depressed, we can be worried. There are like multitude of emotions that might occur. And what we need to understand is that all these emotions that we might be facing, that we might get when we are stressed, is a normal reaction. It's our normal bodily reaction. So even when you have all these emotional surges when we are stressed, what we need to understand is that it's a normal way that our body is coping. The only difference is that when we are not able to manage these emotions, when we are not able to manage our stress, these things get overboard and might result to certain mental health disorders. So yes, outbreak of COVID-19 can be stressful to a lot of people. Like I'm sure none of us had expected anything as like this would happen. So I'm sure none of us had expected this sudden but lasting change. It's like it's here and it hasn't ended yet. We don't know when it's going to end. It's an ongoing process, so it's a very lasting process. And this type of chronic stress, it might lead to certain mental health disorders. Okay, so yes, definitely stress in form of COVID-19, it can definitely affect our mental health. It can definitely affect our mental health. And today's presentation is basically about how we can manage our stress levels. So I'm not going to be talking much about the numbers here. I mean, I'm speaking in front of a journalist, and I'm sure you guys can like dig it up in a matter of minutes. So this slide here is just to make all of us aware that due to the gender differences, stress can also impact us in a more different way. So uh, in terms of this survey, it has also it's shown that stress due to COVID-19 has impacted the mental health of women more than that of males. So you see, it's not just the genetic vulnerability, it's not just the hormonal levels, changes in the hormonal levels. It's the stress, that's the environmental stress itself. It has more impact on females. So we need to be able to cope with it. So the important question here that we need to ask ourselves and ask our loved ones as well, our near and dear ones as well, whether we feel stressed or not. Whether do you feel stressed or not? And if you do feel stressed, what is the reason behind it? So one of the reason behind a very important reason behind it is the change that has occurred after the change in our lives that have occurred after the outbreak of COVID-19. It has caused a lot of disruption, not just in our family life, not just in our social life, our occupational life, our educational life, everywhere. It has like caused disruption in each and every sphere of our lives. And there's loss as well, like due to COVID-19. When we actually think about it, death rates, deaths and all, it loss is there. It's in evident. But when you actually think about it, if you lose a loved one due to COVID-19, it has a it has a very different impact on us. So that's something to think about. Like, if in this scenario, in this past 2 years, if we have lost a loved one due to something else, or is it because of COVID-19, when we actually think about it, we might feel that it's more traumatic if it is because of COVID-19 that we have lost someone. So COVID-19 has impacted our lives a lot, and the fear that we have to live with, and the uncertainty that there is that's there. Okay, so basically, since we are talking about journalists here, you guys have to report on complex and difficult things day in and day out, and it definitely causes a lot of mental as well as physical stress. And there's a thing called as transference. So transference is something that we as a psychiatrist, psychologist, as well as therapist go through as well. There's something called as secondary trauma. So what happens is, when we hear about the negative things that's been happening in our patients' lives, when they always talk about the negative things, it affects us negatively as well. So in terms of journalism, so when you all have to go out there and report on stories which is like directly or indirectly related to the pandemic, and when you have to witness the distressing scenes that have been occurring, it does cause a lot of trauma. It can cause secondary trauma within you. The emotions that other people have, the victims that you have been interviewing, it can be transferred onto yourself. So that is another reason as to why we might be feeling a lot of stress. We might be having difficulties coping with it as well. Okay, so what happens when stress is not managed? So the thing is, there is something called as the stress response system in our body. I'm not going to be very technical about it, but what happens is, when stress level is not managed, when there is chronic stress that's been when we are subjected to chronic stress day in and day out, every single day or every moment of the time, what happens is the hormonal levels in our body, not just the female hormones, that I'm not talking about, not just the female hormones, the main hormone here is the cortisol. So when there is a sudden disbalance in the level of cortisol, it affects our body in a very drastic way. It affects our body in such a way that we are not just vulnerable to physical problems, we're not just vulnerable to other medical problems, but we are vulnerable to psychiatric problems as well. So there are a multitude of psychiatric disorders that we might go through if stress is not managed properly. One of them being anxiety, and to name few others: depression, adjustment disorder, substance use disorders. If we have maladaptive coping mechanism, we might resort to using substances such as alcohol, cigarettes, or even cannabis. So that might affect us negatively as well. And there's also something called as PTSD. I'm sure a lot of you guys are also aware of this, post-traumatic stress disorder. So if we are subjected to life-threatening, stressful situation, it might have a long-lasting effect on us, which might not be apparent immediately after being exposed to the life-threatening situation, but it might occur certain months later on. So coming to the symptoms that we might face, I'm just going to be very brief about these symptoms so that you guys can be aware of it and come forward if any such things, if you are facing with any of such problems. So in terms of anxiety, we might have physical symptoms such as bodily pains, stomach pains, trembling, and feeling that it's hard to breathe, and always feeling on the edge, and also feeling of suffocation or something stuck in your throat, and always being on the edge in the sense that you're not able to focus on something else, other things. And in terms of depression, we might experience the sadness. What we have to remember here is all of us, all of us in our life, we do experience sadness. But in terms of depression, what we have to understand is the sadness that we feel, it's persistent. It doesn't go away. It's persistent in the sense that it might last there. It might be there within you for weeks on weeks end. Okay, so we might feel persistently sad or irritable, which we were not, which was not our normal mood before. So the sadness and irritability might just come in, and it might last. And along with this sadness, you might feel that you lack energy, that you lack the motivation that you had before. You do not feel like interacting with other people. You feel that there is a certain change in your eating habit. There is a certain change in your sleep pattern. And you always think about things that have gone wrong. You feel guilty about things. You feel that it's not worthwhile living, and even might have suicidal thoughts. So that's something to be aware about as well. So, and now coming to PTSD, post-traumatic stress disorder, like I said before, if any of us, if we are subjected to life-threatening, stressful situations, that might lead to post-traumatic stress. So it's not going to be evident immediately after we are subjected to such kind of stress, but it might be evident gradually within months, like over a period of 6 months, we might gradually feel certain things, like we might have anxiety, we might go through depression, and we might have avoidance of certain cues that remind us of the situation, that traumatic situation. And there's always re-experiencing of those things. We get flashbacks, we dream about all those things, we get negative thoughts. And when we have those when we have those symptoms, we might even have symptoms of hyperarousal. That means we might feel that our hands are fidgeting. We might feel very on the tip of our toes, like there's always something going on. So all these symptoms might indicate towards a person having PTSD. And another important thing is substance use disorders. So if we are subjected to stress, our body tries to cope with it. So there are certain adaptive mechanisms, certain coping mechanisms that are good for us, but there are certain coping mechanisms that are not good for us. So in terms of negative coping mechanisms, it might be the use of substances such as alcohol, cigarettes, or even cannabis, or any other illicit substances. So we might get into the habit of taking these substances to to remain calm, to make us feel better. But that's not the good way to go. That's not a good way to go forward. It might just cause dependency on us. It might cause more dependency issues, which might be later on regretful. So these are certain things that we have to be aware of. So what are the warning signs? Like there are certain warning signs that you can keep in mind, so that we ourselves don't go through this type of situations. And even if we are going through these situations, we are aware that we are having these problems and we are able to seek help for it. And not just for us, it's for the near and dear ones around you as well, your loved ones around you as well, your teammates, your colleagues. So if you feel that any of the people around you are also going through all these problems, be supportive. All right. So what are the warning signs? So if there is a sudden emotional change, like for example, if I'm going to give my example myself, like if I am a very jolly person generally I'm a very jolly person, but suddenly I feel that I'm very anxious, and the anxiety within me doesn't go away. I feel anxious for each and everything, or I feel sad, which is like very persistent. And these type of emotional changes, if it occurs and if it's lasting, if it's persistent, then it's something to worry about. Okay, then we might need to think about seeking help. And the other thing is, if any of us, if we start showing any type of behavioral disturbances, if which was not our regular habit. So if there is any emotional disturbances, if there is any behavioral disturbances, if there are any sleep disturbances as well. So in terms of sleep, in case of depression, it's said that in case of depression or anxiety, it's said that a lot of people might have difficulty in sleeping, or they have frequent breaks in sleep, so that they don't feel fresh in the morning. But there's something called as hypersomnia as well. Okay, so it's not just the lack of sleep, it's the excess of sleep as well. If we are always feeling sleepy, if we are like always feeling tired, if we're always feeling really drowsy throughout the day as well, so that might be something concerning as well. Okay, and in terms of our appetite, due to a sudden loss in our appetite, or due to sudden change in our appetite, if we are experiencing certain weight changes in us, significant weight change, that might also be a concerning thing. And other one is features of psychosis, like believing that something that isn't real, or hearing things that isn't heard or seen by others. So if there's sudden appearance of psychotic features as well, that's also a warning sign. Okay, and like I said before, if there is sudden change in the substance taking habit, that's also considered as a warning sign. And for last but not the least, most important of all, if any of us have suicidal thoughts or self-harm thoughts, or if we are subjecting ourselves to self-harm behavior, that is something to be really concerned about. And if we see that our people in our surrounding are going through these type of things, do come forward. So nearly at the end of this presentation, and the most important part of it as well, the stress management techniques. There are certain techniques that we can follow so as to be able to cope with our stress efficiently. So I'm sure all of you guys have heard about being mindful. So here I've quoted on Buddha. Although it's we might come from various different religion, I'm sure we can all agree on this statement, saying which mentions that do not dwell in the past, do not dream of the future, concentrate the mind on the present moment. So that's what being mindful is. Okay, so this statement might not just be very clear as to what we should do to be mindful. Yes, we've all of us have heard that we need to be present here in the moment. It's like here and now thing that we need to do to be mindful. But what is that actually? So a very simple example that I can give you is, for example, if we are drinking coffee, if we are drinking a cup of coffee, be there, be present while you're drinking that coffee. Like, we're always in a rush, we're always late for work, we're always doing our work at home as well, we're more involved with our family, with our kids, that we might not be able to focus on ourselves. So when we are drinking a simple cup of coffee, be mindful about that cup of coffee. All right, be aware of the aroma, be aware of the taste, be aware of the bitterness, be aware of the warmth that the coffee gives you, whether it's hot or whether it's cold. So be aware, make sure that all of your five senses are invested in that moment. So when you are drinking a cup of coffee in the morning, be aware that you are using all of your five senses to be there present, to be present at that moment of time. And when you are doing that, if you are able to be mindful just for few minutes each time, it does definitely help us to relieve the stress. Okay, it will help us definitely to calm down as well. Okay, so be mindful. Okay, and other thing that we can practice is the breathing exercise, and the other one is the muscle relaxation exercise. Okay, so breathing exercise is something that I do myself as well. Okay, there are certain things that I do to help myself be more calm. And me being a psychiatrist, I'm a very anxious person myself. Okay, so I treat people with anxiety, but I do battle with anxiety myself. So there are certain things that I follow, and breathing exercise is one of them. It definitely does help. So what you have to do here is take in deep breath through your nose and hold your breath for like 2 seconds and then breathe out. Okay, like I'm going to be showing in front of you as well. So take a deep breath, hold it for 2 seconds, 1, 2, and then breathe out. Okay, breathe in. Okay, so if you do this for a couple of minutes any time of the day when you're feeling really stressed, it really does definitely help you de-stress. Okay, it really does help you calm down as well. Okay, and you can practice this any time of the day, anywhere you are, even right before you're interviewing someone, right before you have to take the shots. Anytime you can practice this deep breathing exercise. It's not that you have to be right there in your living room or like in your bed relaxing. It's not that. You can do it anytime, anywhere, any time of the day. So it's like very easy, and it's definitely does help you de-stress. And the other one is muscle relaxation exercise. You can try this with any of the muscles in your body, but the easier one here, it would be your fist. Okay, so contract any group of your muscles. I'm giving an example of our fist here. So close it tightly. And when you're closing it tightly, when you're making a fist, hold it for about 5 or 10 seconds. And you feel the warmth. You feel the tension that's happening when you're tightening your fist. So concentrate on all the negative energies in your body. And when you release, just imagine that all of your negative energies, with the release of your fist, it's going away. All right, so you can practice this with any of the group of the muscles in your body, but the easiest one would be your fist. Close it tightly. Imagine that all the negative energies are there in your fist, and then release. All your negative energies are going out of your body, okay? And only the positive ones are within you. All right, so one is the breathing exercise that you can do any time of the day, anywhere. And the other one is the muscle relaxation exercise. That's also something that you can do anywhere and at any time as well. Okay, and it does definitely help. And other one is venting out your emotions. So talking about how you feel is very important. So if you have someone reliable with to whom you can share your feelings with, to a trusted individual, you can always share how you feel. And I'm not sure whether you guys have experienced that or not, but for me, if I'm feeling really stressed and if I do talk it out with someone who can actually understand me, it's very helpful. It's quite helpful. And if if you feel that there aren't anyone in your immediate vicinity or immediate circle to whom you can actually vent out your emotions to, what you can do is you can always write it down. You can always write it down on a piece of paper. That's what usually I tell my patients. Like, if you have any negative emotions, if you feel really bad, do write it down on a piece of paper. So after you do write it down on a piece of paper, like, just tear it apart and like throw it away. Okay, so that also definitely does help. So if you do not have anyone to talk it out with, do write it down. And then after you write it down on a piece of paper, you can like read it, you can like scrunch it up and even throw it away. It helps you relax. Okay, and if you don't feel like writing it down, you can always record it. Nowadays all of us have smartphones, so we can always record it on our smartphone, and we can listen to what we have said. We can listen to the emotions that we are going through, and it does actually it's quite therapeutic as well. Okay, so, and the other thing is, if when we are like feeling very emotional, and if we feel that we want to cry, if you feel that our emotions are like so high that we feel like crying, do not hesitate, do not hold back. If you do feel like you're going to break down, if you feel that you're very emotional, do let your emotions out. It's very much important for us to let our emotions out. Okay, and lastly, direct your focus on the positives. Okay, so there's a picture of here about the half full, half empty glass. So always think about the positive things that have happened in your day, each day. All right, so there, in 24 hours, there might be a lot of negative things that might be happening. We might be more concerned about the negative things, but we might not be more we might not be, more thankful about the positive thing that's been happening. For example, one of the positive things that's happening right now would be, for me, it would be like, there are no power outage over here right now, so I'm able to conduct this seminar with ease. So my internet is not down. So that is one thing that's positive as well. Till yesterday, there was power outage and the internet connection was not that good. So today, thank God, there is there's no power outage and the internet connections is very smooth. So very minute positive things, we need to be able to focus on those things. Okay, so do not just think about the negative things, focus on the very minute positive things that happen on our day-to-day basis. Okay, and other one is, let's not focus on something that we cannot change, that's not within our control. Okay, so there's no point in worrying about that. Okay, so lastly but not the least, what I would like to remind us all is that since you guys are journalists and you guys play a very important part in ameliorating the stigma of mental illness, what I would like to say again is our mental health is as equally as important as our physical health. Okay, if not more. So if you feel that you can relate to any of the symptoms that I have mentioned before, if you feel that you are going through some kind of mental breakdown, and if you do need help, do not hesitate to seek help. Okay, so at the end of this presentation, I would like to say is that I would like to say again is that mental health is very important. And yes, stress is an inevitable part of our life. Okay, not just the stress of COVID-19, there are other stresses as well. So stress is not going to go away. We need to be able to find certain things to de-stress ourselves. Okay, so and I would like to stress again, saying that mental health is very important. It's an integral part of our health. So if any of us, we are going through certain mental health breakdowns or any issues with our mental health, and if we feel that any of our close ones are going through such certain situations, do not hesitate to seek help, support each other, and come forward. Okay, so at the end, stay healthy, stay safe, and definitely stay positive. Okay, so I think now we can go ahead with the question answer sessions if there are any.
Thank you so much, Dr. Richa Mathia. It was very wonderful hearing you. Every bit of words that you explained, it was very helpful for us as we women journalists has been mostly busy thinking for others. So I think this past 1 hour has become a time for our self-realization and self-love also. While we are gathering some of the questions here, I think few of them have raised their hands. Jyotsna Sainju, would you like to ask a question, Jyotsna? Hello, Jyotsna.
Hello. Hello, namaste. Can you hear me?
Yes, you are audible. Please share your question.
Thank you so much, Dr. Ritza. It was a nice session. I enjoyed it thoroughly. I have a couple of questions for her. The first question is, how to show concern for someone near to you who is struggling for mental health, and someone who is near to you who is struggling for mental health problem. And another one is our daily anxiety is different from anxiety attack? We have, like, I've heard people getting anxiety attacks. So is it different from the daily anxiety? We also eventually get anxiety while working or while having chit chats with family. So that's my second question. And my third one is how to take control of cortisol hormone. She talked about cortisol hormone is a stress releasing hormone. So how to take control of that?
Okay. Thank you so much, Jyotsna ji, for being so like we are able to discuss about these questions. I'm sure a lot of people have concerns regarding whatever you have asked as well. So first of all, like you asked, how can we be more supportive towards our near and loved ones who are going through mental health disorders? So the thing that we're always being taught to do, and what we always tell the caregivers of our mental health patients as well, is to be empathetic. All right, to be empathetic means to be supportive as well, to be able to be in their shoes, to be able to understand what they are going through. So when we encounter that any of the people near to us are going through mental health issues, the most important thing that we can do is be supportive. All right, when they talk about their feelings, when they talk about their mental health issues, do not just shove it away. Like, for example, what I usually tell my patients is that if someone breaks their leg, okay, we do not tell them just to rest on their bed and your leg will heal by itself. Okay, so if someone if their leg is broken, we definitely do rush them to the hospital to get the x-rays done and to get the necessary treatments done. So definitely, if someone is going through mental health issues, we need to be supportive in terms that we need to be able to listen to what they are saying, and definitely seek help with us with a psychiatrist, not just any other doctors, with a psychiatrist. So do not hesitate to come forward. Make them understand that it's all right to visit a psychiatrist. It's not a big deal to visit a psychiatrist. Okay, so be supportive in that sense. Be supportive at home as well. Being supportive doesn't always mean do everything for the patients who have mental health issues. All right, be supportive in the sense that help them in certain things, let them do their basic things. Okay, you can help them but not do everything for them. All right, so you can be supportive in that sense. Okay, you can be supportive in the sense that you can take them to the hospital. Be supportive in the sense that you listen to them. Okay, so be empathetic while you're listening as well. So that's one thing. And the other question that you asked was about the cortisol hormone, like how we can lower the cortisol hormone. So what happens is when we are really stressed, okay, when we are exposed to acute stresses, it's not the cortisol hormone that plays within our body. it's the epinephrine and all, norepinephrine, adrenaline and all that's surged up in our body. But when we are exposed to chronic stress, like the stress of COVID-19, okay, the pandemic situation, which has been going on since 2020, since the beginning of 2020, so that's something that causes chronic stress in our body. So when we are subjected to any form of chronic stress, the level of cortisol in our body might rise. So the things that we can do to always keep the cortisol level in check is practice de-stressing exercises. Okay, one of the de-stressing exercises would be the breathing exercise, like I had mentioned before. Okay, the other one is the muscle relaxation exercise. The other one would be mindful. And what I always tell my patients is that give time to yourself. Do not and we always tell them to be busy in something or the other. Being busy does not always mean be busy at work. Okay, be busy with something or the other that's physically or mentally draining, but being busy means being invested in something that you like as well. Throughout the 24 hours day span, what we can do is we can figure out a certain time in the daytime or any time of the day that is more comfortable for you. We can take out 15 minutes, we can take out 1 hour, the time for which we can give to ourselves. Okay, during that time, try to de-stress in the form that do something that you like, do something that you feel that makes you happy. Okay, that might just be making a cup of coffee for yourself, making a cup of tea for yourself, and drinking and being mindful at that time. Yes, smelling the aroma, tasting the coffee. Okay, so that's one example. The other example of doing something for yourself might be some of us might enjoy doing things for ourselves, like, putting on the makeup or like dressing ourselves up. So those are certain things that we can do as well. So take out time for yourself. Okay, do not always be busy. Be busy in something or the other, but not always be busy in the sense that you are physically and mentally tiring yourself. Be busy in the sense that you are taking out time for yourself as well. Okay, and the other thing that you asked was about the anxiety. Okay, yes, all of us are anxious in some time or the other. All of us feel sad one time or the other, like someday or the other. Okay, but what's the difference? Okay, so when we are having panic attacks or anxiety attacks and panic attacks, they are synonymous. Okay, so when we are having such attacks, what happens is there's like a surge of anxiety that's very overwhelming. It comes all of a sudden. At that time, you might feel that you're really suffocated. You might start sweating. You might need to go to the bathroom very frequently. You might feel that your body is trembling. And you might just feel that if you are not taken to the hospital, you might just die then and there. Okay, so those are certain feelings that you might get when you are having a panic attack. But the general anxiety that we might feel when something negative happens in our day-to-day basis, for example, like if we are there in the office and we're just chilling there, and suddenly the boss appears and the boss starts to ask us certain questions. So at that time, if we are not able to answer properly, we might feel very anxious. Okay, so that is something, like I said before during my presentation as well, feeling all those emotions are normal. So if you have any surge of emotions during your day-to-day activities, it's normal to feel such way. Okay, it's normal if you have such emotional outbursts. Like, it's all right to have such emotions, but if those emotions are persistent and if those emotions are like the cause of your stress, if those emotions are getting in the way of you carrying out your day-to-day activities, that's when it gets problematic. Okay, so I hope I have answered your queries. So if there are any other questions, we can move
Yes,
forward.
Dr. Richa, we have a question here, and it is by Sheila Cashman, and she would like to ask, would you also recommend joining support groups or psychodrama groups that one can access in most universities around the world? And her second question says, what about art therapy, music or dance therapy? Is that something you would recommend? Thank you.
Okay. Well, thank you so much, Sheila. Yes, if there are certain support groups, if there are certain, the support groups that are nearby to you, okay, if those things are available within your vicinity, within your reach, then I would definitely suggest that you do try them out. Okay, but the thing with group therapy is you need to be able to be open as well. So if you have any intimacy issues, if you have any issues with trust issues and all, joining those psychodrama groups, joining those support groups might not always be the right thing. So it depends on your personality as well, whether you are quite you might whether you might benefit with the group therapy, or you might just benefit with the individual therapy. So in terms of that, I think it would be best if you would seek help of a psychologist or a psychiatrist, so that they can assess you and they can point out which therapy groups that would be more beneficial to you, whether it's a support group or whether it's the individual therapy group. But definitely, if there are certain things, such things available in your vicinity, I would definitely say try it out. There's no harm in trying. So if you do try, and if it does help, why not do it? Yes. And the other thing about the music therapy and the dance therapy, yes, that's quite refreshing as well. So if you do have time, you can definitely do that as well. The only thing that I would like to point out here is in Nepal here, we do not exactly have certain support groups as such. We do not have dance and music therapy as such. Okay, so if it's not available in your vicinity, what you can do is, you can always, since we are in the world of digital technology and everything, so we all have YouTube with us, we all have internet with us, so we can always surf the net and join it virtually as well. We can always play the music and like just dance alone in your room as well. So yes, listening to music, dancing, it does help release the good hormones within you. It does help you release dopamine, serotonin, and oxytocin and all. So it does definitely help you lighten up your mood and be happy as well. So that is definitely something that we can try.
Thank you, Sheila, for your question. And also, she had written, this is a fantastic session. And for that, we obviously need to thank Doctor. And now, I would like to request our participants, if you have any more questions, please raise your hands or please write it down in the chat box itself. We still have few more minutes, so where we would like to entertain your question. And actually, it is a kind of, even though it is a public online event, I'm feeling like it is an interpersonal discussion forum, so we all are enjoying it. So if you have any questions, please feel free to raise your hands or write it down in the comment box itself. So we have Malika Bhatrai. She is IWAT board member from Nepal. She have a question, so I would like her to put forward her question.
Mr. Saab, I feel like I am very sleepy at night, and then I go to bed, but I cannot sleep properly for hours, like 1-2 hours sometimes. I'm not like any that kind of stress and any kind of depression I do have, but again I have this problem. So is it anxiety like post-pandemic, like what is it?
Okay, Malika ji, problems with insomnia, sleep disturbances is very common. Okay, so first of all, we need to be able to assess why you're having these type of sleep disturbances. Like, is there any form of stress related to this? Whether you had this type of insomnia, this type of sleep disturbances in your childhood as well, or when you were growing up. So it begins all with that. So if it's a habitual thing, for some people there's difficulty in falling asleep since their childhood, so that's something that might be happening since your childhood. So we need to focus on that as well. So if it's something that's been happening since your childhood, it might just be a habit of yours. But however, if you feel that no, it wasn't there before, but suddenly it's been like few months that I've been having this type of problem, it's been few months that I'm not being able to fall asleep immediately after going to bed. And if I feel that it's problematic, then we need to be able to assess whether it's directly related to stress. So stress in terms of the pandemic right now. So if it's been happening since the past 1 or 2 months, it might be related to the second lockdown that we are going through as well. So a lot of people during this lockdown, during this pandemic, are complaining of sleep disturbances. So it might be because of the slight anxiety might also be at play. So definitely we need to be able to assess you on that. So what I would suggest is maybe you can try certain sleep hygienes as well. There are certain sleep hygienes that you can follow. Namely, that would be to go to bed at the same time at night and wake up at the same time despite the amount of sleep that you get throughout the night. So for example, if you go to bed at 10 p.m. at night and wake up at 6 a.m. in the morning, do that. Wake up at 6 a.m. in the morning despite the amount of sleep that you get at night. All right, so make it a habit. And do not drink too much coffee or tea throughout the day. If you are in the habit of drinking tea or coffee, limit the amount and try not to drink tea or coffee after 3 or 4 o'clock in the afternoon, because it might stay in your body, which might be causing you to to have difficulty in falling asleep at night. And there are certain meditation techniques that you can follow as well. Simple exercises would be like breathing exercises. You can do that prior to your sleep as well. It will definitely help. Do incorporate a certain amount of exercise in your daily regime as well. And if that doesn't help, there are certain medicines that you can take over the counter as well, and prescription medicines as well, which can help you with your sleep disturbances. So after trying all these things, if you feel that it's still not working, then I would definitely suggest you to seek help of a psychiatrist or a psychologist, so that we can actually assess you in detail and go ahead with the treatment process.
Thank you. It's been like 3 months, but I'm not that into that thinking so much about pandemic and this and that. But we all are like 1.5 year. We are some kind of locked in house. But I'm not that much worried about like this and that. But I'm not thinking about like I don't think about this and that what's going on around the world. But again, like I feel disturbance while I go to bed. That's why I say thank you.
Okay.
Thank you. It's very.
Thank you for the honest question, Mallika ji. And now we would like to. Okay, now we are almost at the end of the program, and I would like to request all the participants to stay with us because we'd like to capture this moment. But before that, I would like to request our. I would like to request for the vote of the thanks by the president of IWAT Nepal chapter, who is also our leader. May I request Montessori Raj Bhandari to deliver her vote of thanks.
Okay, thank you. Good evening, all. And the COVID-19 pandemic has widened the area of reporting. That is good thing. However, at the same time, women journalists are facing multiple challenges. Most of the women, like us, are working from home. Especially journalists have triple burden, taking care of family, household chores, office work, and personal care. It has affected on our mental, physical, and emotional health. So today, we are very grateful to Dr. Richa Amartye for giving us her precious time and sharing very clearly about the symptoms and give some tips for mental well-being during the pandemic, which is still ongoing and no one knows when it will be ended. So many women journalists lost their job in pandemic time and are now working as a freelancer also. In this tumultuous moment, I believe this webinar could somehow relax our stress and supported us to think positively for new opportunities. Hence, I would like to thank all participants for your active participation. And I, on behalf of IWAT Nepal chapter, I like to express gratitude to Jola, IC, and President Boylet and Mandira for their tireless efforts to make this happen. And last but not least, I would like to thank Manita for coordinating and moderating the webinar. And I would like to thank all and for your time and your participation. Thank you.
Thank you, Montessori ma'am. We're glad to hear from you. Even though we have already presented our vote of thanks, we have really exciting participation here. Our president of International IWAT has a question here.
Hi, Manita. So sorry. I know you'd already closed the session, but I just thought after listening to Mandira, I had one very short question I wanted to ask Dr. Matia. And also, I hope that IWAT Nepal will allow IWAT International to steal the good doctor from time to time so that we can also have sessions at an international level, because I think many of our members will benefit from her insights and the wonderful tips that she has been able to give some of us. I just have one very small a personal question I wanted to ask. I have respiratory problems. I have acute sleep apnea. And right now I'm living in the UK, and we are opening up in terms of the lockdown, the restrictions just in the next few days. And it's freaking me out because now all of a sudden people are not even wearing masks anymore, and the social distancing is getting less and less. Now I'm a journalist. I have to go out and mingle with people. And so I don't know how I can also protect myself, because I fear that if I get this dreaded virus, with already an underlying, respiratory problems, it will become a problem. So it's making me feel so paranoid to the extent that I don't want to go out there and mix with people, and I'm preferring to just do virtual meetings and events, but it's not sustainable because things are opening up. So what advice can you give, people who are in similar situation as myself?
Okay. Yes, Violet. Well, that's a very, the question that you asked, I'm sure a lot of people can relate to that as well. Yes, so definitely the lockdown is definitely easing, and we do have to get back to our physical state of work as well. So the thing is, are you vaccinated? So if you're yeah, so if you're not, okay, good. So first and foremost, get vaccinated. All right. So, and once you're vaccinated, what you can always be assured is, even if you do contract this virus, it does, your body is already in some way or the other, it has it's got the slightest amount of virus from the vaccine, so your body is much more adept to be able to fight with the virus. So you have to think positively in that sense. And the other thing is, like, once you start working, you cannot really change what other people might do around you, right? So some people might wear masks, some people might not, some people might just be coughing right in front of you, right? So all those things are something that it might feel very dreadful to go back to the physical state of work. So what you can do itself is to protect yourself, is like, when you are going outside in the physical setting, always make sure that even if you are vaccinated, always make sure that you are wearing masks, always make sure that you are using sanitizers, and always make sure that you do frequently wash your hands and all, and make sure that even if you do go out, even if you do sanitize your hands properly, the T-zone here, your eyes, nose and mouth, it's called the T-zone, make sure that you do not frequently touch these areas, all right, with your hands. So this will also help you protect yourself from the virus as well. And always what we have to think is, even if there are other people around you who are not wearing masks, but if you are protecting yourself. So you need to be able to do things that you are that will ultimately protect yourselves, but you cannot control the behavior of the people around you. You can suggest, but even if they do not agree to whatever you're saying, there are a lot of people who might say that I'm vaccinated twice, so I do not need to wear the mask. Okay, but that's not completely correct. So you can suggest them to wear the mask, but if they do not, agree to whatever you're saying, make sure that you are protected in whatever the best way that you can, by wearing masks. But maybe you can wear the visor as well, the face shields. Wash your hands frequently and avoid touching your T-zone. So that's quite beneficial as well. And what I would like, if it makes you feel better, what I would like to share with you is that since I work in the hospital, and since we have to take the rounds as well, in the hospital wards, there are a lot of people who have COVID, who are at a very close proximity to us. You see, so there are patients who are COVID positive, and we are in a very close proximity with them. But wearing masks, not touching this T-zone, and washing your hands frequently and sanitizing, it does help. It does help. And in terms of vaccination, I got vaccinated twice, but despite of that, I got COVID. All right, so I not recently, I would say that I recovered from COVID around 2 months back, despite the fact that I was vaccinated twice. So, but I feel that since I got vaccinated twice, it gave my body more strength to fight with the virus, in the sense that I did not suffer a lot. So getting vaccinated, it does definitely help. So I'm sure it will help you, even if you do happen to unfortunately get the virus. What you need to do is you need to think positively. And thinking positively, it does help your body fight with the virus as well. If your morals is down, it does really, it brings the whole body down. But if you are positive, if you feel that you can fight the virus, the body does have certain other type of aura. It does have certain other type of positive energy that it does help you fight with the virus as well. So definitely vaccination helps. Not touching the T-zone again, wearing masks, sanitization, suggest other people around you. If they do not listen, do things to protect yourselves. Because we cannot always, like you said, we cannot always be on this virtual platform. We have to move ahead. We have to adapt.
Thank you so much, Dr. Richa and also Violet. I think some of the participants are in a hurry to leave, so let us have a group picture together. I believe all of us have turned on our camera and we shall start smiling.
Okay, so 1, 2, 3. Okay, I got it. Yes, I see. Did you get it
I got
also?
photos, yeah.
Good, very good. Yes, thank you, ladies.
Thank you so much. Now, as I was about to thank Montessori ma'am earlier for her vote of thanks, likewise, I'd like to thank, I believe like today's webinar was very fruitful and very helpful for all of us. First of all, I would like to thank Dr. Richa Amatia, who is consultant psychiatrist. And also, it was very hard for her to manage the time, but still, she never said no and she never hesitated for all the changes that was about to come in between. So very thankful for your humble and kind behavior for us. And also we believe like this is just the start. We will, as our IWAT president said, that she would like to continue having you later on. I believe we will require this kind of session again and again in future too. And I would also like to thank all the women journalists who participated in the program. And I would like to thank IWAT International for providing us the opportunity here. And I would like to thank IWAT Nepal. Also, I would like to thank, and I feel privileged that I got the opportunity to moderate today's session. And we would like to send people around the globe, love from Nepal, love from IWAT, and love from IWAT International. We believe in conducting such kind of awareness activities, such kind of skill enhancement activities in future too, to all the women journalists around the globe. For today, we would like to wrap up today's webinar, which was named Mental Well-Being for Women Journalists Amidst the Pandemic. Thank you once again, everyone.